Hi, everyone. My name is Noel, and I'm the Deputy Communications Director at Emerge. Thank you for tuning into our weekly Emerge series, where we sit down and chat with women elected officials. Today, we're so excited to be joined by Greenville City Councilwoman Dorothy Dowe, who is also an Emerge South Carolina alum. Councilmember Dowe has invested in the Greenville community through service on numerous boards, including the City of Greenville Public Safety Citizen Review Board, Pleasant Valley Connection, and League of Women Voters, as well as leading PTA and community organizations for the past 20 years. Thank you so much for joining us, Councilwoman.
Happy to be here. Thank you so much for having me.
Great. So let's dive right in. COVID-19 has had a devastating impact on every community, and elected officials like yourself, especially local, have been sort of on the front lines of this crisis, dealing with constituents directly. How has the pandemic affected your community in Greenville, and what have you been doing as a member of the City Council to support your community during this time?
Well, our community has been affected more so than most in the state of South Carolina. So Greenville County, for the county, for the better part of the COVID pandemic, has had the highest numbers in the state. Within our own, so the city of Greenville is within Greenville County. We have been very proactive in measures to follow the CDC guidelines. So I think from a city, our numbers aren't broken out separately between municipality and county, but we know by zip code. So if we take a look at those numbers, you know, our response has helped in the city, but there's a lot of movement of people from within the city and the county, you know, back and forth. So you know, we've been fighting it for a long time, and have definitely felt the effects more so than the rest of the state.
And so what are some of the things that you've been trying to do to support your, like, what are you hearing from your constituents in terms of support, and how have you been providing that?
Sure. So, you know, to paint a picture, a year ago, and, you know, I guess we're really about a year plus a couple of weeks, you know, certainly nobody could have foreseen how long this would last or how bad it would get. Certainly nobody that I intersect with right now. And I will say, in the early parts of the pandemic, when you think about things with this level of threat, it's a natural inclination to think that guidance will come from a higher authority. So we're the lowest level of government, the smallest level of government, and it was reasonable to expect we will hear something from the state level and the federal level. And there's an inclination to, let's wait and see what that response is to guide us. It didn't come. It just simply did not come. And I remember thinking, you know, into April, it felt like the wild, wild west of government. You know, we were it was clear from the start we were on our own. I don't mean that disparagingly, but I'm just speaking truth of what was going on. And that's probably because at the higher levels, they didn't know what to tell us, right? So at the time, Dr. Fauci was coming on the scene as
Saint Fauci.
Right. I mean, he was making a splash, and I remember being in a room, sort of a planning session with the mayor and the city manager and some key staff members in the leadership team, and the mayor said, you know, we have got to get out in front of the public and speak to this, and what if we went Fauci style?
Sure.
So, you know, we didn't feel equipped to speak the science, but we community at Prisma Health as well as at Bon Secours, and basically did a setup similar to Fauci's presence at the federal level. And with that partnership, we always had the science guiding us. They had our back in making the decisions we had to do. We were the first municipality in South Carolina to put forth a mask ordinance. Other municipalities, you know, followed us. That was a really bold step, unheard of, but with the support of the medical community and the science behind that, we were able to do that. So that was kind of the small first step. And then from there, regularly we had press briefings, live press briefings with the medical leadership behind. And you know, I think that just gave people a sense of direction, you know, of taking the bull by the horns and managing our own community as we were able to do in the absence of leadership from higher levels.
Yeah, that's something that we noticed during the pandemic as well, especially within the Emerge Network. Democratic women and, women who were leading their communities in various capacities really did step up to fill the void in leadership, whether it's from the White House or from their governors or from,
Mhm.
folks in executive Republicans in executive leadership who just weren't doing their jobs.
Yeah, I mean, clearly I live in a very red state.
Mm,
And at the time, this was during the Trump era, and personally, being a Democratic woman, a graduate of Emerge, I wasn't willing to wait on them. I
sure,
didn't feel like it was ever going to come, and
sure.
and I think with time, council certainly felt that way too, and I have to give the mayor credit for recognizing that very much so as well.
Hmm. And just because I'm curious, because I know you've just been so close to this and you've been working so hard to help your community through it, like what does recovery look like for you and your community? Like what do you envision in terms of light at the end of the tunnel? Which I think now that vaccinations are up and people in communities across the country are taking the guidelines seriously to help us see the end of this, what does that look like for you all?
Well, something to not forget is the economic impact of it.
Mm,
And so as we got our feet under us with just communicating to the public about what we were seeing, what we were going to do, and why, there
mhm,
was also this: how are we going to keep our economy going to the best of our ability? Something I'm particularly proud of is at the time we we're working on funding probably the largest project we've undertaken in Greenville, and that is the Unity Park construction. It is largely funded by hospitality tax in our community, but yet here we had our hospitality industry, falling.
mhm,
The hardest struck by far by COVID. We were able to find a funding structure to give small business boost grants from the money raised for Unity Park. It wasn't a lot, but every little bit. If you think back to June and July, every little bit counted. I mean, it
mhm,
could be the difference in rent for a business owner. So just having the ability to think outside the box, how can we get grant money? Greenville very much depends on public-private partnerships and the philanthropy of our donors. How can we use some of that money to lift up the bootstraps of our hospitality community? And we did that. Then, of course, the PPP started coming through and the federal response financially. Um, we met a new normal in COVID. So certainly by the fall, everybody was getting used to this isn't going away anytime soon.
mhm,
And then in November, I certainly felt hope was coming. And then in January, certainly when the vaccines were announced, we became very hopeful. The challenge, again, in hindsight, we certainly knew this was going to be the case, but just distribution of the vaccines was the next challenge. I certainly don't feel like a system was in place from
mhm,
President Trump's administration. I certainly give them credit for coming up with the vaccine and financing that.
mhm,
But in terms of getting it into people's arms, again, nothing.
mhm,
So at our level, of course, we let our healthcare community lead that charge. But what we're seeing, as we get forward to it, is everything's set up through access to the vaccine through the internet.
mhm,
And I was a caretaker for my father for years and recognized that the elderly and or the disabled do not function that swiftly on the internet. They don't necessarily have email. They certainly aren't necessarily comfortable on the internet. So now if they can't get an appointment without being, adept at the internet, they've got another access issue. So as a city, we've been facilitating access to just booking the appointments for them. So we have several call lines set up in community centers for anyone to call that is having trouble getting an appointment for a vaccine.
mhm,
Now we're phasing into, as that vaccine supply comes up, what can we do to bring the vaccine itself in to the communities that have been disproportionately affected by COVID?
mhm.
So that's kind of the phase we're in now. Our limitation is vaccine supply, and I'm sure we're no different than most others.
Mhm, mhm. Yeah, and I think, everything you just said just points to the fact that, local offices like yours are so important. You all are the first line of defense when it comes to a lot of these issues and helping, the policies that happen at the higher level sort of trickle down in an equitable way. I mean, we've been hearing constantly about the issue of equity when it comes to vaccine distribution. And, when people look to just like who's in charge of this, and it's just like our local elected officials, our state
Yeah.
officials, the folks who are on the ground. Yeah.
Exactly. I mean, I think there are a lot of things in COVID and the vaccine have been great examples of a great idea at the top, but then how do you make it happen?
At the
And at
bottom.
the local level, how we make it happen. The local level is what affects people so much more than anything at the top level.
Absolutely. And sort of, going off of that, outside of COVID, what are some of the other issues and, priorities that you have for your district and for Greenville?
Sure, sure. So, again, the needs outside of COVID never went away. So coming into and I was elected and began service January 1 of 2020, and in March 13th of 2020,
Yeah.
COVID took over the priority.
Right.
So immediately, things had to change, like budgeting, priorities, all that had a great shift. Nonetheless, I think as for me and for the rest of council, our core priorities are still right. They're right here. Yeah, we got to deal with COVID, and we deal with that on a daily basis. But the challenges and the priorities that we had before it's not like they've went away. So I ran and continue to have the priority of providing access to affordable housing, access to transportation, and the third priority is really coming into play now, and that is implementing our Greenville 2040 comprehensive plan. So in South Carolina, we're required to do a comprehensive plan for land use every 10 years. We just completed ours and adopted ours, and that means you've adopted, a 75 to 100-page document of language. Now, what are you going to do with that?
Yeah.
So I'm all about let's do something with that rather than it being, a notebook on the shelf. So we are working on, that movement towards rewriting our land management ordinance and our zoning that will help steer growth in a way that we want it to go, and in the types of growth that we want for the next 20 years.
Great. Yeah, it sounds like you all are doing a lot. So
yeah, my sleeves stay rolled up. I mean, you talk about roll up your sleeves. I haven't rolled them down. They're there.
Yeah. We love to hear it, though. Love to hear it. That's what emerged women do.
Yeah, I'm very fortunate to be serving now. Yeah. I mean, I just, it is this job, and I'm an at-large member on city council. So my district is all of the city of Greenville. We have a 7-member council. 4 represent geographic districts, and then there are 2 at-large members, which I'm one of, as well as the mayor obviously represents all. So I have 70,000 constituents in Greenville, not to mention the other stakeholders, the community of people in the business community that work in Greenville. They may or may not live here, but they work here and they do business here. So they too are stakeholders. And because of all that's going on, it takes, and, just because I'm on an emerge call, I'm biased. I just feel like women are great ball judges and taskmasters, and that it is really testing those abilities of me.
Absolutely. We need more women in office.
I'm not arguing for that.
Yeah.
I agree.
Speaking of which, I can't let you go without asking you a couple of questions about running for office, since we have women who are watching who might be interested. So, for folks who might be looking into it, why did you decide to run for office, and how did Emerge South Carolina help you on your journey to getting there?
Yeah, well, first of all, for anybody that's watching and taking an interest, thank you. Thank you for even paying attention to politics in general and how governance works, and being willing to immerse yourself in that climate, at whatever level you want to serve. So, I mean, no doubt, Danielle, I can't discount the point that November of 2016 certainly drove me to an introspective time in my life.
Sure, yeah.
And I will say, I was a big supporter of Hillary Clinton. I had that sign in my yard. I made sure I voted. All that. But I definitely could have done more. So after November of 2016, when President Trump was elected, I really immersed myself. First of all, there was, a period of mourning that a lot of people went through, and collaborative mourning. And I think that's important, because when you do that, you've got to look at what could we have done differently? And then what was my role in it, So I definitely, for my entire, adult career in Greenville, I've through fortune or luck or deliberate action, I've been in leadership roles at different levels. And there have always been people whispering in my ear, kind of, when are you going to run for something? I think that's what is said to people who are comfortable in leadership positions. I was very active in my children's schools. Certainly there were whispers that you should run for school board. And that just never appealed to me, just because of the way the financing works for the school system. South Carolina. It wasn't something that I thought was a good match for my skill set. So, after that mourning period, after November 2016, I looked at, I had a good friend who said, one of the reasons Dems aren't winning anything around here is that they're not even running. Most of our seats in South Carolina were going unopposed and had been unopposed for generations almost.
Sure.
And so that was an eye opener to me. But I said, for me, I'm very data driven. I said, okay, so we need a bench. We need a bench of candidates. I'm on the bench. If not me, I looked at it as, if not me, then who? I felt like it was the right time in my life. I was, from a personal family standpoint, I was able to serve. I really want women to know what they're getting into as a candidate, and there are ways to find that out, and to look at the numbers, look at the analytics of what you're trying to go for. We are unfortunately limited by where we live. Unless you want to run for president, you are limited on exactly what seats you can run for. And that plays into it. But that's really important to look at, and just know there are more. Like, I knew, okay, here I am on the bench. Okay, I don't feel qualified to run for president. So that knocked that one out. I don't think I'll get called for vice president. That got knocked out. And then you have that conversation with your significant others of how much are they willing to move? Are they willing to be mobile or whatever? And this seat really fit my skill set. I knew I loved Greenville and wanted to serve it. And like we said earlier in this broadcast, what affects us most is at the local level. And I knew during the Trump presidency, what happened every day didn't affect my life that much, but what happened at the local level affected me every day. So, that's rewarding enough for me.
Absolutely. And I think, one thing that we and this from the training, is that, we're about connecting women, having them connect their passion to a specific office, right? Like, it's like, what do you want to tackle? What are the things that you're trying to address, and, will help you get there. Well, Councilwoman Dowe, thank you so much. This conversation has been so enlightening, and it's great to hear about all the fantastic work that you're doing. We're winding down on time, but again, thank you so much for the great work that you're doing. I know this conversation will help women who are interested in running for office and finding out where to start. So thank you for joining us, our audience, for this episode of Emerge at Work featuring Councilwoman Dorothy Dowe. Subscribe to our channel for updates and for more conversations, and be sure to follow us on social media at Emerge America on Twitter, Facebook, and Instagram. Thank you again, Councilwoman.
Thank you so much, Danielle. I appreciate the opportunity.
All right, great. Bye, everyone.